Hello all, welcome. Welcome to our second webinar in a series on communications co-hosted between the African Palliative Care Association and Global Partners in Care. You will note, first of all, that this is a meeting format, not webinar format. And we did that intentionally so that we can have some discussion and breakout sessions during today's webinar. So stay tuned for directions on that. My name is Lacey Ahern, and I direct programs at Global Partners in Care. One of our intentional objectives working with the African Palliative Care Association is to work to support national associations and national level work in global palliative care, whether that be based at ministries of health or other national level entities. So that is the focus of today's webinar. We look forward to working with you and providing some guidance on how you can improve the communications from your entity and then share that message with your members to enhance their communications capacity as well. So we have a really great panel with us today. I will introduce each one as we move on to the next speaker. And to kick us off, we're going to start with Wezerai Chioka from the African Palliative Care Association. She is our Master of Communications on the continent, and she is going to kick us off today. Welcome.
Thank you, Lacey. Good afternoon, everyone, and welcome to this webinar. You might be aware that this webinar is a continuation from the one that we first held in December. And so I'm just going to recap quickly on the purpose of why we started doing these webinars and some of the expectations and benefits of having a deliberate focus to make your presence online to be impactful. It's one thing to be online and another thing to actually be there making an impact. So I'm going to just share my screen and share I'm going to share a presentation. It's a very quick PowerPoint in a few minutes. Just a second. Okay, so we are hoping to make this a series of a number of webinars that will cover different aspects of being online, just to help, because all of us are on different stages of advancement or ability. So others are beginners, others are well advanced, and so there's room to bring along, which is really why we've called this one bringing our members on board, because now some of our national associations are quite well advanced in their online presence. They know how to use being online, they know what they need to be doing. And so it's good to bring everybody else online and to bring them up to the same level. This is almost an obvious slide. This slide is stating the obvious. Online platforms have emerged as important media of communication globally. And the reason why is because they help us to reach a vast audience in a short space of time. Within a minute, your message is read across the globe. And in our sector of the not-for-profits, we find that our funding goes quite a lot into programs and providing services to those in need, not necessarily to PR, not necessarily to communications. And so this has become a favorable way for our sector to stay in touch with our audiences. Online platforms have enabled our sector with limited budgets to reach a larger audience, spread our messages, tell our stories in a way that is cost effective. Of course, needless to say, now with the COVID pandemic restrictions, We have seen the need growing actually to be able to communicate online, to be able to communicate electronically, digitally, and not restrict yourself to the need to do a physical visit in order to get your message known. You don't need to do a physical visit in order to carry out a training and so on. So this it has only made the need greater. Typically for our sector, we use online platforms to reach to like-minded entities. This is how we can connect with other people working in palliative care, other hospices, whether it's potential donors or other people who can be advocates for our cause. Also, we can actually convert people to our cause by engaging new entrants, people who are just coming online. We can also convert them to our cause using these platforms. Someone can come across a post that you've put on social media, for example, on your website, and they take an interest. And so every post or image or video or comment that you share, it's a chance for someone to react. And this can be your old or your new old followers or potential new followers. A reaction can also lead to a site visit. Many relationships have actually been formed through being online. Site visit, eventually a partnership can develop into that. And then a big session of our session today, a big section of our session today will be covering the discovering feature, where we can use algorithms that use our search comments or our likes to suggest similar content for us, and they give us better user experience. So if you are always searching for issues that relate to hospice care, if you are searching to issues that relate to chronic care, and so on, it will actually, the algorithms will help you to find such and to suggest similar content to you. And likewise, for people who may not be aware of who you are and where you are and so on, they can also find you because the same algorithms will direct them to your content. So this is very important. It's not just about reaching the people you know, it's also about people discovering you and you discovering them. So there are many options. I think part of what we should think about, because we are in Africa, is to think where are the biggest audiences to be found? What is the most easiest, easily accessible medium or that platform that we can use? Also, it also depends on the purpose why you are communicating. Generally in Africa, you find that the professionals who want to interact with like-minded professionals will often do that on Twitter, and they'll do that on LinkedIn. But if you want to reach your broader community audiences and you want to reach your students, you want to reach, people who are in CBOs and so on, you often have to be on Facebook, because that's where you find a whole mix of audiences. So you have to be also, it's not just a question of being online, but also knowing what am I aiming for. A recent survey showed that 9,000, a recent survey of 9,000 not-for-profits showed Facebook as the non-profit's primary social network, followed by Twitter. So I gave those two examples. And the popular channels with NPOs, other popular channels include YouTube, LinkedIn, Pinterest, and Instagram, in that order. Because of the different types of media that you want to share, if you want to share videos, if you want to share photos and so on. But have clear goals on what it is you want to achieve, who are your target audience, and what action, if any, you want to make. I think Cindy will cover more of that. Also, being online, if it is focused, if it is well thought out, it can help you with fundraising. Almost 40% of people discover nonprofits that they donate to on Facebook. 40%, that's a significant percentage. So if you are looking to be noticed, you're looking for support, it's good to place yourself online. Make sure you have an organized platform and people are clear what you are doing, and your goal for being there is also clear. And this bullet just says, unfortunately, people read less and less nowadays. It's more so even in Africa. People like the visuals. People like you see all these videos that are going on these days, and pictorial things. People prefer infographics and so on, rather than reading a text that tells us what you are doing. So you're online, you share a picture, it can tell 1,000 words. It can tell a story without necessarily writing a whole essay or a whole story about it. So we also have to think about mobile-friendly websites, because most people want to access their information on the go while they are sitting on a train, on a bus, or while they are stuck okay, I won't talk about being stuck in traffic. But people do like to access while they're in a queue, stuck in a queue, for example, just access their information on the mobile. So as we think about that, think about being also accessible. So this just shows the internet users in Africa. Since we are trying to promote being online on the continent, we have, as APCA, we have a lot of members, over 6,000. We have over 4,000 individuals and over 2,000 institutions and organizations who are members of the African Palliative Care Association. But you find that when we look for our members online, we find just a handful. There are very few of them who are online. So we want also to use these webinars to promote being online for palliative care organizations, especially to make sure that our agenda on awareness of palliative care, on support for palliative care, is not forgotten, because the more visible we are, the more people will remember and will commit to our cause. This is just a slide that maybe if you can just focus on the yellow boxes, they show the population of Africa that's got access to the internet, and that's almost 40%. And also, if you check also the other one, it shows those who are on Facebook in terms of the actual number of people, and you've got more than 200 million people there. So the potential to reach people with a message is big. And if our members, a lot of us today are national associations, and a lot of us are ministries of health, and others are umbrella bodies. So if our members are not online, we are missing out on an opportunity to reach a huge component of the population that we are serving, whether it's at national level or district level, whatever level you might want your visibility at. Let's try and get our members on board. Let's get them online so that they drive for hospice care, they drive for palliative care, they support for palliative care advocacy initiatives, and so on. They get the attention, they don't fade off because there are no physical visits, or because there are limited meetings and there's no transport, there's no budget to reach people, and so on. If we are online, we can target who we need to see. So this is it from me. Thank you, Lacey. Let me just end it here.
Great, thank you very much, Wazrai. That was a great overview. I just want to address one question I saw. Yes, we will make the recording available. The slides will be available after this call. So please know we will send those to you and you will have access to these resources. So we're going to move quickly now on to our next speaker. And this is Howard Kinyua from KEPCA, the Kenya Hospices and Palliative Care Association. Howard, thank you for joining us. And we are going to hear firsthand now from a national association that is really doing an exceptional job of extending their communications online. And so we're going to hear a few best practices from Howard before we move on then into some of the practical skill building for you. So Howard, I turn it over to you.
Okay, thank you so much. So good afternoon, good morning, wherever you are. It's almost evening for us. So thank you, Wazrai, for sharing all that information and the statistics. It makes my work a little bit easier. And so I'll just share my screen. Let me put it on slideshow. Just a moment. Yeah, I think now we're good to go. So it's projected on my screen, and I think you can see it on your end as well. So we are here to discuss the impactful online presence, bringing our members on board. And I'm going to touch on, the National Association and also how to bring our members on board. So the National Association viewpoint, and I'm going to use KEPCA because that's where I work. So KEPCA is an institutional membership organization, and the members are drawn from hospices and palliative care units in government and non-government hospitals. So our members are from, we work with county governments to integrate palliative care in government hospitals, and we also have freestanding hospices as well in Kenya. And those are our main members, and we also have individual supporters of the National Association who are referred to as friends of KEPCA. So the difference between an individual supporter and the members is the members have a voting power when it comes to the annual general meeting. If we want to vote for the board, they usually have a say and a voting power. So our vision is to ensure that there is quality palliative care for all in Kenya. So we are found in different online platforms, and one of them is Facebook, where we have 4,362 members at the moment. And as I mentioned, after the webinar, feel free to like and follow us on social media. We have Twitter, where we have 3,705 followers. Instagram, we have 306. And we have a website. We usually have traffic in the hundreds. I usually use Google Analytics every week or every 2 weeks to monitor that. YouTube, we have about, I didn't indicate the number, I think it's about 15. There I've got my work cut out for me to drive traffic on our YouTube channel. And finally, we have LinkedIn, where we have 306 followers. So why are we online as an association? So the main reason is to reach our target audience. And I mentioned earlier, the members, and we also have partners, we have donors, and also key industry stakeholders, which are like the Ministry of Health, whom we work closely with with the county governments to have palliative care units in across the country. We also have a civil society organization and the general public. Now this is Kenyans, first of all, and then the rest of the world, and advocates, because our main, the things we do here at KEPCA, it's mainly advocacy, the job that we do as an association. So the next thing is to inform. So these can be things like upcoming events, like webinar, calendar events, what we plan to do for the year, anything matters arising or updates. So we have organization news, and we also have published articles in the media, and we have been fortunate to have many articles published in the media in the last 6 months. And we also, on social media as an association, to interact and engage with our audience that I've mentioned before. So if someone has questions, they can send a DM, they need clarification, or if someone has said something on the comment section that needs to be replied to, it's easier to reach them that way as compared to other forms of communication. So like telephone and all that. Social media is faster, and also the response can be real time. So, and here I mentioned that you need to respond as fast as possible. So usually keep checking your social media platforms to be able to respond, because people don't appreciate it when you keep them waiting for too long. So we also create awareness on social media. It's a great tool to create awareness and reach a wide audience with your message. Even Watsera alluded to that earlier, so I will not elaborate on that. So you have a global audience, and it's cost effective. And as I said earlier, it helps when it comes to advocacy for persons living with palliative care needs in Kenya, because you are able to reach a very wide audience. So our members at KEPCA. So KEPCA is an institutional membership organization whose mandate is to scale up access. I think I mentioned this earlier, sorry about that. how to engage your members. So the first point is to post content that is relevant to your audience. So you need to be very clear on who you're trying to communicate to, because that will help you to identify not only to craft the message properly, but also you will have them in mind as you craft the message, as you share the image, or whether it's news or updates about your organization. You are able to do it with clarity because you know who you are communicating to, who you are trying to reach with your message, or things like campaigns. So this can be messages, videos, and pictures. So the next thing I said, it is always share what you're doing as an organization. So this is important for your members to feel included and to be in the know of what's going on in the institution. Even when it comes to people like donors and your partners, it's important for them to know what's happening. And if they follow you as they should on social media, it is easier for you to communicate with them, to be able to track what you're doing, and they're able to feel like they're involved. So find out the next point is find out what platforms they use most. So whether it's Facebook, Twitter, Instagram, or Pinterest, and other social media platforms. So with that, I think it comes with time. When you post messages, you're able to see the interaction. On which platform do people interact more with your content? So this one you find out as you test the waters, as I did. For me, it's usually Facebook and Twitter. Those are the ones that are most active for me. So be interactive. When people want, you are able to respond to people, and also make sure that you do it in a timely manner. Don't keep people waiting for too long. So share up-to-date content with members. So just keep them in the loop of what's happening. You can use your blogs when it comes to updating upcoming events. Just keep them in the loop of what's happening in your organization. So the next thing you need to use templates that are favorable to both mobile and desktop users, and especially most people usually use mobile platforms. So I think it's best you have a template that people can be able to access, whether they're using mobile or desktop, that is user friendly. The next point is find out what content they interact with most. So whether it's pictures, videos, text. In my case, it's mainly pictures. I find out people usually react to posts with pictures than those that don't have pictures, like plain text. So stay active on social media. That's the next point. You can choose the amount of time you require to be online daily. So it's up to you to decide whether you want to be there full time, whether you will be checking it an hour or every 2 hours. It depends with the engagement that you have with your audience, the online community. And I think this also comes with time and also the demand that's there. So the other point is you can host industry related webinars. That's something we used. We have like community. We have CMEs. That's what's it? Continuous medical education. I beg your pardon. So those are things we are doing. We're actually starting this month. So post webinars that are related to your industry. This is able to drive traffic to your platforms. And also you can, when you're doing these webinars, you can have them on other social media platforms like YouTube Live, Facebook Live. That also helps to drive traffic to your social media platforms. So you can send out member surveys, maybe after the webinar or after an event. You can you can send online, like you can try to have their feedback on what works, what doesn't work, what they like, what they didn't like. This will also help you to identify your strengths and your weaknesses. So it's like a SWOT analysis when you do a survey with your audience. So you can publish a few short videos. In our case, I think I haven't done that much, maybe very few, but I'm going to be doing that. I'm going to be engaging in that, in posting videos in the coming months, so for advocacy purposes. So I feel like, it not only drives traffic, it can drive traffic to two platforms. Maybe if you post on YouTube and then you link it to your Facebook page, you are able to, people are able to see and also to share your content. So you can ask members to support a cause or fundraising. I think also when Zerai alluded to this earlier. So it helps when people you ask people to your members to, you can use social media as a platform for people to fundraise. Like you can maybe send out links, messages, and people actually feel more involved, and you're able to attract a bigger crowd, even more than your members, anyone who follows you on any of your platforms. So I think for the things maybe I'd like people to remember most from this presentation is if you're trying to come up with content, so you need to have clarity on who your members or target audience is. This will guide you to know what content will be relevant to post across your platform. As I said, that was my first point when I started the presentation. You need to know who you're communicating to. So it kind of sieves, yeah, the people you're talking to. So you are able to filter out so the people who are not relevant and who's relevant, and to help you to craft your message. And also another thing is to understand the mission, vision, and core values of your organization. I think just like in life, you need to have some sense of purpose and direction in your life. The same case, you need to know where your organization is going, the mission, vision, and the core values. And this will also help you to stay focused. The content that you post, it's actually relevant, not only to your institution, but to the member organizations. So finally, since I'm in KEPCA, Palliative Care Association, I'd like to say palliative care is everyone's business. And thank you so much for your time. And I appreciate you listening to me. Thank you so much. I hope it was worth your while.
Thank you very much, Howard. Very worth our while. You had some very good points in there. Thank you so much. So next, we are going to move on quickly to our next panelist. Hannah Nichols is part of the Hospice Foundation, which is a hospice and palliative care organization here in Indiana. They actually are in partnership with the Palliative Care Association of Uganda and have worked together on a lot of communications with that. Hannah is, I would say, going to take us into the next step of the detail. So she'll pick up on some of the things Howard shared and give us some detail about how do you identify, your target and actually move these things forward on your social media. We want this to be very practical for you so you can actually begin to do these things. So Hannah, let me turn over to you. Thank you.
Thank you, Lacey. So I was going to introduce myself, but Lacey did a great job, so I won't bother. And I did want to note that this will overlap a little bit with some things that Howard said, which I think is great because it bears repeating. And it is important to learn. So we are going to cover mainly social media today, focusing on Facebook and Twitter. And I will start with those of you who maybe don't have an online presence at all on social media, or maybe have a page but don't do a lot with it. So we'll start there and then kind of work our way into those who have a strong presence and want to increase that impact. So first, let's talk about the best practices for getting started with your social media pages. First thing, before you do anything else, you want to create that business account. You don't want to use a personal account to try to do your organizational's work. If you create a business account through either social media platform, it really legitimizes your organization and helps your followers interact with you. Second, you always want to set that organization's logo as your profile photo. So as you can see here, I have a screenshot from Global Partners in Care, and their logo is just a little bit too large for that circular profile photo. So instead, they just used the icon from their logo, which is very recognizable. And then they put their name there, clearly and very recognizable again. And then they did that, the @ you see there. So that's their tag. So that's what people will tag them as. And it's Global Care News. And so you want to, again, make that recognizable, make it easy, easy to spell, easy for your followers and your constituents to find. And that profile photo, you want to keep that as your logo and not change that around too much. Your header image, where you can see above the profile photo, that's where you can really showcase your mission and change that out throughout as time goes on. So next, you want to start building your audience. And you can do this by simply inviting your staff. If you can encourage your staff to be involved, that's great. You want to invite your personal friends to like your page, and just start getting your message out about, hey, we're on social media, please follow us. So you can share your page name with your constituents and staff via your email and other channels. Your website's a great place to do that as well. And then my favorite tool to start getting building your audience is liking partner organizations with your page. And this can be partners or members or donors, different people that you interact with daily. And so as you can see, there's a screenshot to the right here. And again, as Hostas Foundation, if I wanted to like Global Partners in Care's page, you just hit that 3-dot drop down there and scroll down to like as your page. And so this does a couple of things. It shows the partner organization that you have a social media page. It gives them their name, it gives all of the information about your organization, and it notifies them that you liked their page. And the great thing about this is hopefully it will encourage them to like you back, and then therefore building your audience. And it also builds then your legitimacy, again, as an organization just starting out. So the next is these platform tools. So Facebook and Twitter both have lots of platform tools that you can use, and they're all free to use. And so this may seem a little overwhelming at first, but we are going to, as Lacey mentioned, we're going to share the slides. And then we also have some great links included as well to get you started on these things. And then we're also happy to schedule one-on-one calls with any of your organizations to make sure that you know how to use this and get started with your organization and see it firsthand. So we're happy to schedule those as well. So this is my favorite platform tool that both Facebook and Twitter offer. So as you can see, you go to your business page, and this may look a little bit different on a mobile platform, but it should have most of the same capabilities. So on the left-hand side, you want to hit publishing tools and then go down to scheduled posts and hit create posts. And it's as simple as that. You can schedule out your posts that way for up to, I believe it's 6 months. And this really helps with time management, especially as you're getting started and are trying to kind of plan out your content for the week or for the month. This helps see it all in one place. You can edit it after you've gotten it scheduled. You can see videos versus photos, things like that. And then you can change the content around if you decide that the content needs to be moved to a different day. And then in the right-hand side, you can see on Twitter, it's just as easy. You hit new tweet and then hit schedule. So from there, another platform tool that is probably the most useful tool to any of your organizations is the Insights or the Analytics tool. So Facebook calls this Insights, and this is available when your page reaches 100 likes and follows, and Twitter calls it Analytics. And so I have the link there that you'll be able to click on after the fact to get started with that on Twitter. And then I have a screenshot here again of what this looks like on Facebook. So you can see countless and numerous information about your followers and your constituents. And this is wonderful because you can see what country they're from, what time zone they're in, what gender they are. You can see their demographics of what they like and what they're interested in. And there's so much information about your followers here. So it's a really great tool to make sure that you're utilizing. And then the screenshot I have here is one of my one that I go to very often, and it's when your fans are online. So this is a rolling 7-day period, and it actually shows when your fans are, what time period they're online and when they're most online. And this helps you later on when you're getting ready to schedule posts to time them correctly. And again, just to note, this may look a little bit different on your mobile device. So just make sure that you get in there and play around with that and see what tools are available. It is a little bit more robust on your desktop. So if you have access to check it, once a week or once a month on a desktop version, you may get a few more analytics there. So some general do's and don'ts for getting started with your organization, or if you already have a page built up, these are some great general practices as well. So do tag other organizations when you're mentioning them, and make sure that you go back to that previous slide and you've liked their page first. That helps to find them. So on the right-hand side here, I have, as Hostas Foundation, I want to tag Global Partners in Care in a post. So basically all you do is hit new post or new tweet, and then you hit that @ symbol and start typing their name. type slowly and give Facebook a little bit of time to catch up, because sometimes it does take a couple of seconds for it to register what you're trying to do. And then basically you just select in that drop-down menu which organization you want. If you're having trouble finding them, go back to their page, make sure you've liked them, and make sure that you've typed it correctly and have their correct name. That really helps. Don't ever post misinformation or misleading titles. We call this clickbait. Facebook and Twitter both will actually remove the posts if they're inaccurate, and then they can also limit your pages show the what they show to your constituents if you do this too often, and they really frown on this. So just make sure that you're posting accurate, relevant information, and that's always direct and straightforward, but you want to use emotion and things like that. So we'll talk about that a little bit later. And then do create a small monthly or a quarterly budget to advertise if feasible. So then the next question is content. I know it can be very daunting to start posting and to say, where do I get all of this content? How often do I post? I don't even know where to begin. So we have kind of a general rule of thumb. With Facebook, you want to, and this is a work towards, so you don't necessarily going to start here, but work toward 1 post every day. Twitter, you want to work toward 2 posts every day, at least. So you can definitely add to that as you gain experience and time. And then start with, if all you can do is 2 posts per week, that's okay too. Make sure you're starting with getting some content up and a regular posting schedule. And again, going back to that scheduling tool will really help you do that. So where do we get all this content, right? It's a lot of information to find and post, and it can seem daunting, but really you already have most of it, which is wonderful. You can take photos of your staff in the community. You can repurpose stories from your latest e-blasts. And I love doing this because it's not feasible to expect everyone to read every story in your e-blast or on your website. So posting it in multiple places is actually a really great thing to make sure that your content is read and that your followers have access to your information. If you're having a great weather day at the office or it's particularly rainy, post about it and then show how that impacts your mission, and relate it back to your end patients or your donors, and how that affects them, and really just make it all about your mission and what you're doing. Use what you have around you and highlight your work every time, highlight your team, and the content will start to flow in. So now we've talked about the basics. So now we're going to move into, I already have a page. How do I increase my impact? So the first thing to understand is those algorithms. They were mentioned a little earlier as well. So basically an algorithm is a complex behind the scenes function of the platform. So Facebook and Twitter both have various algorithms, and basically they decide which posts people see and what order they see them in. And please note, these change all the time, and the platforms themselves do too. So that can seem a little overwhelming as well. But if you understand the basics, it really is easier to understand going forward, and you can kind of follow those changes as those platforms make them. So what's the purpose? The purpose of an algorithm is to give people a good experience, to keep them interested in scrolling, and ultimately to see more ads. They want their followers, they want the people that are using the platform to see more ads. And this is the end goal of the algorithm. So this means this is good news for your organization if you're posting engaging content, because the platform will actually reward your page. It will show it to more people if you're posting engaging content. So more engagement equals better user experience for your followers and constituents, and then ultimately shows them more advertising for the platform. So everybody wins. And so there's hundreds of things that the algorithm looks for, and there's no way to keep track of all of them. But over time, there have been 4 consistent things that the algorithms look for. So if we can master these 4 things, then you will be well on your way to understanding the algorithm and doing it and making sure that you're showing your content on a lower budget. So first is the relationship. Do your followers engage or interact with your content regularly? If so, they'll see more of your posts. If not, we need to find some ways to boost that engagement, and we'll talk more about that. Second is the content type. What type of medium or what type of media, excuse me, do you use? And Howard talked a little bit about this as well. Text, photo, video, links, etc. And the great thing about this is those insights and analytics tools will actually show you what type of media your followers like most. Howard mentioned that his really like photos. So of course he wants to use more photos in his posting. And then as you move into video, that's a great thing to use as well. So definitely look at those insights and see what people are interacting with and then post more of that. And then popularity. How are people reacting to the post? The algorithms work to show your followers things that your friends are posting about or interacting with. So for example, if 10 of my friends are commenting on one post, I will definitely see that post in my newsfeed, because Facebook and Twitter both want you to see what your community is interacting with. And they see your community as your friends and family, not necessarily the organization themselves. So if you can get people interacting on your page, all of their friends will see it. And then recency, how old is the post? Newer posts are always placed higher, so make sure to go back and time your posts for when your audience is actually online so they'll see it. So the next thing to understand is the reach. What does that mean, and what types of reach are there? So there's two types of reach. There's organic and paid. Organic is the number of people who have seen a post that was unpaid, that wasn't advertised. And paid reach is the number of people who have seen a post that you actually paid for or that somebody paid for. So this is important because, unfortunately, organic reach from businesses and organizations has been reduced by the platforms in recent years. And this sounds like a bad thing, and it may be for organizations, but there's lots of ways that we can work around that. But the good thing to know is that, Facebook and Twitter want to showcase your business. They want to showcase your organization and get your word out. There's ways to get around that, and there's ways to work with the algorithm to make sure that that happens. But if you can start with that small monthly or quarterly budget, that will definitely boost your impact for that paid reach. And again, we're happy to schedule one-on-one calls with you to get you started in that and to show you how to do that. So maybe we don't have a budget, or we have a very limited budget. How do I get started with that? With working with that algorithm. So the first thing is you always want to reply as soon as possible to messages or comments on your posts. And, whether this is a message to your page or this is a comment on one of your posts, you want to interact and respond as soon as possible. Even if it's just a simple thank you, Facebook loves to see that, and Twitter does as well. They love to see that interaction from your page and creating that communication. And then you want to post with the engaging content that people want to discuss. Encourage followers to have conversations with each other on your posts, and make sure that they are engaging with each other. And that's the important thing that the platforms really want to see, that people are having conversations not only with your organization, but especially with each other. And then use emotion. Likes aren't really enough anymore. You want to get them to love it or to care about it, to cry about it, whatever you can do to create real meaningful content that plays on your followers' emotions. Facebook especially loves those. You can hover over that like button and you can do all of those different actions. They want to see those actions. And with Twitter, even though they still only have the like button, they want to see those shares and responses and retweets. So then the next thing is, again, and we've covered this, but it is so important, is to post when your audience is online. And then next, videos are your friend. Videos get a higher percentage of interaction than any other content type across both social media platforms. And then you want to make sure to upload those videos directly to the platform you're using. So if you post a video on YouTube, great. Make sure to repost it then onto Facebook, not necessarily sharing the link, but actually uploading it to the platform. And then again, taking the time to upload it directly to Twitter as well. And this will get you more interaction because each social media platform wants you to upload that content directly there. And then this was a fun statistic I found, go live. Live videos have actually gotten 6 times more interaction than any other post type in the last year. So it really goes to show that, especially as we're all stuck at home, people want to see your office, or they want to see your community. They want to see your staff interacting. So get them to go live, show them your environment, show them what's happening, and just create a really good engaging live video. It doesn't have to be high budget. It can be on your smartphone. Just show them who you are and what you're doing. And I have a great resource here as well on how to do that. And then Facebook Live also has some great resources. If you go to their help center page, they have some great resources on how to do that as well. Don't spam your audience. You don't want to post too often. And really a good rule of thumb is unless it's a connected tweet or a story that you're telling, you don't really want to post more than once an hour. And then invite people who interact with a post to like your page. This is my favorite free tool that Facebook offers. And so if you can see on the right-hand side here, you see those, we have 62 likes, 7 loves, and 1 care. So this would show up underneath a post. You just click on those and it will bring up this box. And the great thing is you can see that I can invite all of those people who have interacted with that post to actually go in then and like the page. And this then helps that organic reach that we talked about, and helps to, it will invite that person. So let's say we're inviting Robin to like your page. And then hopefully Robin will continue to interact with our page and see our posts from then on. And it builds that organic reach, and it's completely free. I love this tool. Some more ways to boost engagement is to get your staff involved. Staff love to see photos of themselves. They love to see videos. And then make sure that you're telling them that you're posting about them, and ask them to go in and like and share your posts. If you have an e-newsletter or an e-blast or on your website, post your social media links there and encourage your people, your followers, the people that are reading your news, to go in and actually like your social media pages and make it as easy as possible for them. If you can do 1 click to like, that's great. You can have a giveaway and get people to interact for that item, whatever you're giving away, onto your social media pages. So promote it in your e-blast and say, hey, go to our social media pages. It doesn't have to be anything big. It doesn't have to be anything, that's something you wouldn't have if you have some like branded items. That would be great too, but just make sure you have a good plan in place to actually get that end item to the user. And then again, just tag other organizations when you're talking about them. And if you're still struggling with getting those organizations to engage, call them. Ask them to reshare it, to ask them to post and tag you back. It's hard for people to turn down that personal ask. Another great thing I love to do is if a donor is dropping off donations to your organization, take a photo of them and say, hey, we're going to post this on our social media pages. And if you need to, write down the name of your social media pages and send it with them and say, please share this, please tag us back, please interact with us. Because again, people love to see themselves, and they really will interact if you just have that extra second to email them or call them ahead of time and say, we're going to tag you, please share that. And then so just, some key reminders. I know this is a lot of information, and of course we're going to share this with you again, but just, it takes time. So be patient. It's really worth if you can schedule out an hour to a week to really just invest in this, or even an hour to a month, if that's what gets you started. It takes time, but it is so worth it. And that engagement will come. And then the platform help centers are your friend. Use them whenever you have a question. I have both Facebook and Twitter's links listed there. Facebook also has a great Facebook for Business page that you can follow and interact. And it just has some great tools and tips to get you started and to keep you moving throughout the process, but that you can find really any information there. You can type in keywords if you aren't really sure what the question is that you have. There's just so much, it's a plethora of information there that can help you along your journey. And then last but not least, I have my sources as well. There's some great tips and tools in each of these to get you started and to use some of those platform tools. So thank you so much. Please, again, if you have any questions, put them in the chat or let us know, and we're happy to answer those in the breakout sessions as well.
Thank you so much, Hannah. That was a lot of rich detail, but really good guidance for the group. I want to just insert one quick thought that I know most of you are thinking of. Generally, we are very good about patient privacy, consideration of utilizing ethical content when you're taking photos. And so just to remember that you have to keep all of those things in mind when you're doing social media content as well. And particularly, I was thinking with the live streaming, great idea, Hannah, great way to get people to engage. But, live streaming from a patient's home, or, those are probably things we don't want, you don't want to violate any privacy issues there, or ethical considerations. So just to keep those in mind as you're generating your content is really important. I'm now going to turn it over to Cindy Sierfas, who is our Director of Partnerships at Global Partners in Care. Cindy has a very strong background in communications, and she's going to just take us into our next activity. Cindy, thanks.
I have to remember to unmute, sorry. Thanks, Lacey. It's so good to see familiar names and familiar faces here. I'm so glad that so many of you could join us today as we talk about this very important aspect of social media. One of the things to pull both Hannah and Howard's pieces together is what we would like to do is help all of us boost our social media audiences and our followers. So if you can put in the chat what your page at is, or what your Twitter at is, we will compile those, and then certainly you can look in here and start following each other. We are each other's audiences on much higher levels here as well. We have many of the same concerns. We have many of the same advocacy needs. And this will also help us boost our relationships. It will help us boost our engagement popularity when we all like and share each other's social media posts on both Facebook and Twitter. So if you already have a page, please share your page, like for Global Partners in Care, the @Global News, in the chat here. We're on the webinar, and then we will share those out with everybody who's participating today. And that way, then we can all make sure that we're following each other and being engaged there. Another housekeeping detail, just as a reminder, is that we will be sharing the slides today. We'll be sharing the recording with everyone. So if you didn't get everything on the first time through, we will be making all of this available for you to spend more time with. And as Hannah mentioned, we are very happy to do one-on-one Zoom calls and walk through how this can work for you, whether you're really trying to go to the next level of social media, or if this is something that you're just really getting started with and you'd like somebody to bounce ideas off of, or make some adjustments in how you're approaching it. We don't know everything, but we've had quite a bit of practice with this and are happy to help guide some of your steps in this. We're also now setting up breakout rooms. We have an advanced room if this is something that you've been doing for a while and you're really looking at how can you bring more of your members into your messaging, how can you help them with their messaging. If you're looking to boost your engagement or your popularity, that's probably the room for you. If you don't yet have a page, or you haven't been very active with the page you have, we also have a beginner's room. And Wezarai and I will be in that room. Hannah and Howard will be in the advanced room. And so we're happy to help you at whatever level you're at right now. Feel free to join us with that. After the breakout rooms, we'll be in there about 15 minutes. And after that, we'll be doing a wrap up and doing a very short Q&A after that. So Lacey, are we all set for the breakout rooms then?
Yes, I have just opened the rooms. You should all see a message. Hopefully that's come up that allows you to choose either the advanced or beginner room. So go ahead and put yourself in those rooms. If you're having trouble, just message me here and I can assign you to a room if you're having trouble figuring out how to get into a room. Good, it looks like most of you are getting into your rooms. Again, if you're having trouble, feel free and just send me a note in the chat and saying which room you want to go into and I can assign you. For those of you still in this main room, if you can hear me, it means you are not in a breakout room. Feel free to join either the advanced or beginner rooms. If you are having trouble moving yourself into a room, please go ahead and just put in the chat here or even just speak up, let me know and I can move you into a room. Okay, there are still a few of you in this room with me. If you'd like to choose one of the breakout rooms, the point of these rooms is to give you a chance to really bring up your particular issue, your beginners, your advanced issues you might have, and the facilitators will work with you. Great. So if you just want to send me a note, I can assign you to a room, you can elect to join. All right. Good, I'm getting you assigned. There's just a few of you left. Okay, for those of you left in this room, Ephraim, Gladys, Tonya, Shem, Jane, Rumbidzai, if you don't know where you want to go, you can go ahead and chat with me for a moment and we can figure out which room to assign you to.
Yes, I don't know where to go to.
Hi, Jane. Okay, let me ask, are you really a beginner with social media or you have some experience?
Hello.
Yes, Jane, can you hear me?
Hi.
Okay, Jane, we're having some trouble, but I'm going to assign you into the beginner's room, I think.
I have some few experience.
Okay, well then how about we put you in the advanced room and then you can ask some specific questions. Why don't you go into the advanced room? It's a smaller group, so you should have the opportunity to really engage more with the people there. So I'm moving you to the advanced. Whoops. Jane, can you hear me? I'm stopping the video, Jane. Shoot. Hello, Miriam. Miriam, if you can hear me, I've assigned you to a breakout room where discussions are ongoing. Hello, Jane. Hello, Jane, can you hear me?
Hi.
Hi, Jane, I hear you.
Yeah, sorry I got lost.
It's okay, the network seems so challenging. I think we are soon returning to this room, but
Yes.
let me ask you, were you thinking, were you in the beginner's room, the advanced room? Were you able to join one of those and get something?
No, I was not able. Okay, to I am not a beginner, but I'm not very good in it.
Okay.
So I could not get to the advance.
Yeah, that's okay. So Jane, I think what we will do,
Yes.
let me ask you, you are with,
Mm-hmm.
you're a palliative care nurse at a hospital. I see your
Yeah,
registration.
yeah, yes, I'm at a hospital. We call it Kikuyu Hospital
Okay,
in
at Kikuyu.
Kenya.
Yep. So I think the best thing will be for you to do,
Mm-hmm.
what I think is going to happen is that Howard is going to have an additional session for
Mm-hmm.
his constituents in Kenya to have some very specific
Okay.
targeted, this was kind of broad across many countries. So the idea now is the Kepkas, Pekaos, Haspas, they now can have a smaller session. So hopefully
Yes.
you picked something from today, and you can even begin the likes, the follows, those simple things. And then I think follow up with Howard for some
Yes.
subsequent direction specifically for the Kenyan hospices.
Mm-hmm.
That's great. Thank you for the
It's all
work
right.
you're doing.
Yes.
Okay, I'm just going to, I need to send a message to everyone that they just have a few minutes
Yeah.
left. And then
Thank
we'll
you.
come back. Thank you, Jane.
Wow. Also, thank you too. Two. Lost.
Okay. Ephraim, hello, are you there?
Hi, Lucy. Yes, I'm here.
Hello, how are you?
I'm very well, thank you. How are you doing, Lucy?
Very, very well, thank you. I'm glad you were able to join us.
Yeah, thank you very much for organizing such a platform.
Yeah, well, this, as I was just noting to Jane, who's with us here in the main room, this is meant to be just kind of the beginning big picture, and the hope is that then we can work more specifically. I know with Hospice Ethiopia, you have so much going on, but I think we can work with you more specifically.
Oh, that will be really very good. And it was actually one of the areas that I would like to pay better attention in this year. You know that we have actually a website and we're trying to use Facebook, but we need to also, set up Twitter and other social medias. And we have a lot of activities, and we are also, I think, have been privileged to be working with worldwide hospice palliative care alliance, so that they were like in their websites and medias. Yeah, so it would be really
Good,
appreciated to work
good.
with you as well.
Yeah, we will make sure and follow up on that. In fact, Cindy, I see you're back here with us. Good, people are coming back. Cindy will be mentioning Ephraim in her closing here about we'll be offering to schedule one-on-one follow-ups with everyone to really target your specific platforms and goals and move some of that forward. So we definitely will be able to do that.
Perfect. Thank you very much, Leslie.
Great, you're welcome. Okay, Cindy, I'm going to close the rooms, which should push everyone back here,
Okay.
and then you can just go ahead and wrap up with the group. Whether you want to use slides or not, we have a brief time, but at least we can wrap up and follow on with scheduling.
Okay.
Yeah.
It looks like we lost some people leaving the breakout rooms.
Well, it still shows for me.
Oh, does it?
Well,
'Cause I'm on-
9. No, we still have maybe we lost just a few people, but we still have between this room and the other two. It's just they have to come back. I
Oh, okay.
think they just have to push that they'll join back.
Okay.
I've closed the room, so they'll close in 30 seconds. So
Okay. Great.
people should be pushing.
That should bring everybody back.
Maybe some don't know how to close the room. We help them to close the room and they come back automatically.
You're right, Rose. I've closed the rooms. In 10 seconds, they will shut down automatically. So hopefully they'll be back here in just a few seconds. Okay, and then Cindy, I'm just gonna mute myself and let you.
Okay. Very good. Well, it looks like people are coming back to the main room now as we wrap up. I'm just going to quickly share a couple of slides. I think I'm going to. Okay. So just touch on in the wrap up, really bringing our members online has been part of the thinking with what we were doing here. And so certainly the first point of that is making sure that you as an umbrella national association have an online presence, whether it's through Twitter or Facebook or both of those platforms. That's the first step. The second step in that then is going to be able to share with your members what you're doing and then to cross amplify messages. So for example, if you have a very important advocacy or awareness message that you're sharing, you may want to inform your member organizations who are online that you are going to be posting this information and ask them to share it, ask them to like it, ask them to retweet it. This information will help, again, amplify that message for everyone. So what I'm going to do in the wrap up then is share one or two of the key points that was covered in the breakout. And Hannah and Howard, I asked if there was something there that came out of your room that you thought would be beneficial for the rest. One of the challenges. Oh, go ahead. Sorry.
Oh, I see Howard jumped on too. He can go first if.
Yeah, so I think from the discussions that we had in our breakout, the main challenge was on analytics. So how to leverage that. That's from the first person who asked the question. He asked how to use analytics, and also I think the other challenge that came out is how to keep the conversation going or your online platforms active if you don't have a dedicated person to actually update posts on the social media profile on the social media platforms. So yeah, those are the ones that come at the top of mind. So how to use algorithms, and also how do you keep the posts active even if there's no one to man the social media platforms. Yeah.
I would agree with that. I think those were the great discussion points. And we discussed where to get that content. You know, that seems to be, I know for us at Hostas Foundation, it's a daunting, it's very cumbersome sometimes to find that content. So we talked about using blog content, reposting that, driving people to your website when Ghana is working on getting their blog up and running, which is wonderful. And then also using, you know, again, engaging staff. Howard had some great points on using the eHospice website. They have some great medical articles that would be relevant. So we just gave some basic information on how to get started. And I really emphasize that if you can get started posting, it really will become easier if you can get even just one post a week, 2 posts a week, and build from there.
Mm-hmm.
Yeah, and on the challenge, just to add on that, the challenge of not having someone to man to post on a regular basis, we suggested scheduling. So you can schedule your tweets and Facebook posts in advance, maybe like during the end of the week, like Friday afternoon, you can schedule a tweet or a post for each day, maybe one a day. Yeah.
Well, in the beginner room, we had, I think it's coming from the same point, which is we're small organizations and even getting started is difficult because we don't have funding for a communications person necessarily. you know, to work in these areas and get this posting done. And one of the things that I shared there, and I think is relevant for all of us, is that getting our stories out there is how we tell our story in a meaningful way to help find people to fund this very important work. If we tell our stories well and we tell them broadly, we are very likely to find that donor. We're very likely to find that foundation. We're very likely to find people who are on social media, organizations that are on social media, who see this wonderful work and are moved to help support it. The more we share our stories, the more we share our work, and the more broadly we share that, the more likely we are to receive funding, because there's nothing about palliative care that is not touching, that is not bringing out the best of humanity. And in days like these, people want those stories. They want to see this work. And there are organizations, there are individuals who have the capacity to support this. We just need to find them, and social media will help us do it. And so I'm suggesting that the way forward in this is, even if it's 10 minutes, 15 minutes, to start working on content, to start working on scheduling, make those first commitments to that time. Because as we build these stories, we build our capacity for funding as well. And so wrapping up, I have 3 questions. Sorry, I had 3 questions that I would like everyone to think about as they think about their online presence. What steps do you need to take to have a more robust presence online? And again, maybe it's dedicating that 10 or 15 minutes at a time to start the scheduling, to start pulling content together. Also, how can you encourage your members to be more active online? Is this something that, as a national umbrella association, you could host a webinar? And I think I speak for everybody at Global Partners in Care, and I think for ABCA as well, is that we would be happy to help you as national associations, as umbrella associations, to have a similar webinar to this for your member organizations, so that you can start to build that countrywide presence in a very focused way. And then, are there other ways that GPIC can help? You know, certainly we're offering to do one-on-one consultations. I put my email in the chat. You can email me at any point. Please free to reach out. I'm very happy to talk one-on-one with any organization. Or again, if a national association thinks it would be beneficial to do this at that level, I'm sure that we can make arrangements for that. And so with that, I think we are about 2 minutes over, and I would like to toss it back to Wezarai and Lacey for any last wrap up that they think may need to be done, and for our farewells.
I can just thank everyone for being here, but also just to encourage, even though we have limited resources and limited time, it's a bit of a chicken and an egg. So, you know, it's better time and see the results that will also come from it. So I think it's worthwhile investing our time to be online, to be more visible. And with limited physical contact, let's get our members also to be online, especially so that even in the districts or regions across the country, palliative care is being discussed and it stays visible, it stays, people continue to support it and they see its relevance. Yeah. Thank you. Back to you, Lacey.
Thank you very much. And thank you all those of you who stayed with us to the end here. We will be following up with an email with the details of today's webinar, the slides, the resource document. And then I will also share the Facebook and Twitter handles that you have shared so that we can all like and follow and support each other. And then as Cindy and others noted, we are available. We are very willing to do a one-on-one consultation with you, your organization, to help you make some of these advances, maybe set up your scheduling for your Facebook posts. Hannah can help us think through that. So please email any of us. I put my email in there to coordinate it. You have Cindy's email. I'll note this in the follow-up email as well, but be in touch with us. We're happy to continue to support you in this, in these efforts, because it is so important. So thank you to all of our panelists, our speakers, to all of you who stayed with us and participated. This was a very rich session, and we look forward to being in touch with you. Thank you so much.
Bye, everyone. Take care.
Bye-bye.
Bye.
Bye. Thank you.
Thanks all.
Bye.
Thank you, everyone.
Yeah. Thank
Bye.
you. Good night, sir.